Hi, I'm Dr. Hackie Reitman. Welcome to another episode of Exploring Different Brains. And today we're so lucky because we travel all across the ocean and we go all the way to Belgium, where we find Dr. Bieke Kreps, who I first met out at the American Academy of Developmental Doctors and Dentists. And Bieke does so much in so many different ways, and is, amongst all the other things she's doing, besides being a wonderful dentist and besides taking care of a lot of people with special needs, she's also the Belgian director of Positive Exposure Belgium. And we're going to learn a lot more about Dr. Bieke Kreps. Bieke, welcome.
Thank you, Hackie.
Thank you so much for being here. Why don't you introduce yourself to our audience, because I know how excited I was to learn all about what you're doing and where you are and everything that's going on.
So I'm Bieke Kreps. I'm already 32 years old, and I'm a pediatric dentist and mainly specialized in treating children with special needs and medical compromised children. I have my own referral practice, which is hospital-based in Belgium, where I work in collaboration with maxillofacial surgeons. Next to that job, I also work for the university here in Belgium and also at NYU. So after my Master of Science in Pediatric Dentistry, I did an externship in Seattle at the University of Washington, and afterwards I was in touch with New York University, and now since 2015 I'm an adjunct associate professor at NYU. So I'm going back and forth to New York every 2 months, and over there I mainly teach and do research about cleft lip and palate and craniofacial conditions. And I was also born with a cleft lip and palate, so it's from a personal experience and also from a professional experience. I give lectures to the students over there.
Well, it sounds like you're not busy enough, Bieke. I mean, come on, let's go.
Yeah.
You're only doing 42 things simultaneously. Tell us about your involvement with the wonderful people of the AADMD.
So I got to meet Steve Furman, who is very involved in the AADMD and who also founded Special Smiles, or the Special Olympics, in 2014 when I was in Berlin at the IADH meeting. We started talking and it never ended, actually. He became actually my father in the United States, so it's really lovely to have a person like Steve over there. And he introduced me to the AADMD. So in 2015, there was an AADMD meeting in LA at the same time of the World Games of Special Olympics. So that's how I got involved in, that's how I got introduced to the AADMD.
That was also my first meeting when I gave a keynote at the AADMD with Tim Shriver and you and everybody there. And Steve Perlman is certainly one of my all-time heroes. What a dedicated man he is.
He is. He brings so many people together as well. He introduced me to a lot of people, even to Rick Guidati of Positive Exposure, where I'm now volunteering for. So it's just wonderful to know Steve and just all the people that I've met through him. It's amazing. So
well, that's a natural segue into positive exposure. Tell us about that and how you got involved and what's going on with it, because a lot of our audience hasn't heard of positive exposure until right now from you.
So Positive Exposure is an international nonprofit which is based in New York. It uses the visual arts to celebrate our human diversity. So we use photography, film, and narratives to celebrate our human diversity. It was founded by Rick Guidati, who used to be a former fashion photographer, and he founded the organization in 1979. It's grown as an organization. We work worldwide. We do photo shoots. We We have several programs like Pearls, which are positive exposure ambassadors who just blog about their life experience. We also have our FRAME program, which is Faces Redefine the Art of Medical Education. In short, educational films about a specific condition like Down syndrome or Treacher-Collins syndrome. The people themselves with that specific condition and their families talk about how it is to live with this specific condition and also deliver the medical information. So it's from a patient, more from a patient perspective. And with FRAME, we want to change how medical information is presented to medical students and also healthcare providers. So, and that's one of my favorite things to do. And it's also those films that I use them a lot in my lectures as well. And our dream is to have a FRAME library. I think we have now 20 films, but our hope is to grow more and to have this as part of our medical or dental or nursery curriculum in every school in the United States and also worldwide. So,
well, that's great. And you know, I went on the website for positive exposure, and there's so much great stuff on there. You know, Bieke, before I was introduced to you and started learning so much, I was, even though I'm a medical doctor, though I'm an orthopedic surgeon, and many of my colleagues don't feel we're like real doctors because we're not the smart ones, we're the jocks. But anyway, I was rather ignorant about cleft palate and all of its interactions with so much of the development of our children around the world. Could you expound upon that so we can educate our audience as well?
So actually the treatment of cleft lip and palate actually extends over a long period of time from birth to adolescency to adulthood. There are several surgeries that the kids need. It also affects their speech, their feeding, their hearing. But every cleft in every individual is very different. So even when two individuals have like a unilateral cleft of the lip, it's different. So you can't compare them. And there's a lot of variety in clefts, like you can have a cleft lip and cleft palate, a cleft of the alveolus, but you can also have them unilateral, bilateral, incomplete, or complete. So there's so much variety. And most of it, you also have a lot of syndromes who are associated with clefts. So, and there are more than 300 syndromes described. So it's a huge variety of everything. And it is the most common birth anomaly worldwide. So it's 1 in 700 babies born with a cleft.
Wow, I never knew that. Now, I'm going to be speaking to an audience out in Jackson Hole of dentists and specialists and endodontists. And what message from Dr. Bieke Kreps should I deliver to them that might be good for them to hear?
What I always say, just like related to treating children, treating patients with special needs or other medical conditions, is just treat them like they would be your own child. And don't be afraid. It's not because they have something that you have to be afraid of that child. And speak to that child. Don't speak to the parents. They have feelings as well. Although a child can be like 2 or 3 years old, just give them warmth and love and don't be afraid.
Well, that's very well said. And you know, in my 30 years of practicing orthopedic surgery, that was our mantra at Orthopedic Associates, which was just what we wanted to do is treat every patient like it's your own family, and that's the litmus test. What would you do if it was you or your own family? How would you treat that individual? Would you do surgery or would you not do surgery? Would you be nice or would you be mean? What would you do? And I think that's a good golden rule for all of us, whether it's dentists, doctors, or whomever to follow. Another thing I'd like you to enlighten our audience about that I'm very ignorant of is the differences for what we're talking about today in Europe versus the United States. Like I don't travel much. I'm kind of provincial, just, I know what's going on here, but I really don't know what's going on over in Europe as regards neurodiversity, intellectual differences, and a lot of the work that you're doing.
So I think the main, actually the first difference is that the culture, the medical culture, the healthcare culture is different because we do have a socialized healthcare system in Belgium and mainly in the most countries in Europe. So everyone has a health insurance, so it's more accessible for people. I do think like towards donating to nonprofits and grants, there's way more in the US. Because of that social healthcare system, a lot of, apart from our taxes, we have high tax, apart from our taxes is already for nonprofits. So that's something that is different than the US. And the grants in the US are also way a lot more, and also the amounts are way higher than in Europe because of that social healthcare system. But towards neurodiversity, I think it's kind of the same. I do think like people, adults with depressions, with other like bipolar disorders or other mental issues, it's way easier for them to get to a doctor because it's way less expensive. So I do think that issue, like with addictions and other stuff in the US, is something that's really bad and that's still growing. So I do think in Europe and in Belgium, it's easier to get help than in the US.
Wow, well, that's a big difference and an important one, especially because here in the United States, mental health isn't really recognized in the same domain as if you break your arm or something. And it should be. And it's one of the things we're trying to do at Different Brains, because it's not just mental health and it's not just intellectual and developmental differences, and it's just not neurological issues like Parkinson's and Alzheimer's. It's all under one roof. And many of the tools that work for one, and a great tool would be everyone to have access to medical care. That would be a good common line. How does our audience learn more about you and what you're doing, Bieke?
If they want to learn more about positive exposure, where my heart is, they just have to visit our website, positiveexposure.org. I also founded the European headquarters, which is Positive Exposure Belgium, but we will change our name in Positive Exposure Europe because we want to grow even more. And mainly also our big dream is to have it as part of the curriculum, medical curriculum. So people can always reach out to us, so that will be helpful and amazing. It's all about collaborating with other people, with other organizations as well. It would be wonderful if we can set up something with you as well. So it's about helping everyone.
Absolutely, we're glad to help in any way that we can, and the stuff that you're doing and bringing out the beauty of all these individuals is amazing stuff, and I've enjoyed looking at some of your exhibitions and things, and it's just terrific. Tell us about what your upcoming. You're going to be out in the AADMD at their upcoming meetings out in Seattle this year, isn't it?
Yes.
Tell us a bit about that.
So I'm actually presenting, I'm giving an oral presentation about FRAME, our program FRAME. We collaborated with AADMD. They're actually developing it's a pilot study curriculum that they are testing in several schools. It's where they're educating about developmental medicine. So it's a curriculum with several tools. It's a toolbox where the students can choose different programs, different materials to learn about specific condition. And we developed 5 new FRAME films for that curriculum. So it's something that we will present over there. And autism is also a part of our new FRAME film. So, yeah.
What kind of, when you go to the operating room, what are the cases that you're doing? What are the types of cases?
And are mainly cases that are not treatable under sedation or on the local anesthesia. So children with a lot of tooth decay, with severe early childhood caries, or medically compromised children, when there are also sometimes dental developmental defects. So it's mainly when the children are not treatable under sedation or under local anesthesia, but always like severe cases and a lot of work to do. So,
Dr. Bieke Kreps over in Belgium, thank you so much for being a guest here on Exploring Different Brains.
Thank you so much, Hackie.
Exploring Different Brains is a production of Different Brains, Inc. For more information, visit us at differentbrains.org.